So, hello. I did have a view of the audience earlier, and I recognised some faces. So, hello, Amanda, who's sitting in the second row. My name is Imogen Levy. I would really have loved to have been there, but I am nursing a bit of a chest infection. So, apologies if I have to cough a lot. I thought it was best to just be at home for this one. My role is head of product for a program called First Contact, which is a relatively new program in NHS England. And our focus is on rethinking how people access healthcare, ensuring that patients are guided to the right care at the right time in the most efficient way possible. Now, this year's World IA theme of challenges of change, I think is particularly relevant to healthcare. Change in this sector is constant and complex, driven by evolving patient needs, digital transformation, and increasing pressure on services. In this landscape, traditional information architecture, like static hierarchies or predefined pathways, are really no longer sufficient. Like, we must find new ways of thinking, leveraging AI and dynamic systems to help patients access care seamlessly and ensure that healthcare navigation is future-proof. Healthcare is one of the most critical services in society. It affects every single person at some point in their lives. And yet, for many, the reality of accessing healthcare can feel overwhelming, frustrating, and at times impossible. For years, information architecture has focused on structuring and organising information so that users can find what they need efficiently. In many domains, this works really, really well. Online shopping, where structured categories guide users to what they need. It works for libraries, where books are categorised to be easily searchable. But what happens when a structured system is no longer enough? What happens when the complexity of real-world decision-making outpaces a static framework? That's exactly what we face in healthcare. The NHS is a vast and vital system, but it's often difficult for patients to navigate. Too often, they don't know where to go, they don't know who to contact, and when they finally do, they face bottlenecks and delays. So the question we need to answer are, how do we make accessing healthcare as intuitive as possible? How do we design an experience where the right care is always within reach? And how do we shift from a system that puts the burden on the patient to one that actively supports them? Now, these are the questions we're tackling in our work stream, which we're calling Intelligent Navigation, which is really about a new approach to guiding people seamlessly through NHS services, leveraging AI, real-time data, and human-centered design principles. Today, I'm going to talk through why traditional healthcare navigation is broken, how intelligent navigation aims to solve these challenges, and how AI and information architecture can work together to create a model for accessing healthcare. This isn't just a technical upgrade, it's a fundamental shift in how people experience healthcare. Imagine it's the middle of the night and you or a loved one start experiencing worrying symptoms. Your mind starts racing. Is this something serious? Should I wait until morning? Should I call 111? Should I go to A&E? You pull out your phone and you search online. You find advice, but it's not specific to you. NHS 111 is an option, but you've heard mixed reviews about how helpful it is. A&E seems like the safest bet, but you know you could be waiting for hours. You want someone to just tell you what to do. This isn't just a minor inconvenience, it's a major failing of the system. Confusion about where to go leads to delayed care, unnecessary visits to emergency departments, and increased pressure on already overstretched services. And it's not just about emergencies, routine care is also fragmented. Booking a GP appointment, accessing physiotherapy, or finding mental health support should be seamless, yet is often frustrating and inconsistent. Today, the burden is on patients to understand how to access their care in the right way. but the data shows the system isn't working efficiently. 1 in 3 GP contacts could be handled by other services. 40% of A&E visits could be treated more appropriately elsewhere. 30% of patients struggle to get hold of their GP, causing delays. And 40% of NHS 111 users are redirected back to primary care, often getting stuck in a referral loop. These numbers highlight systemic inefficiencies that impact both patients and providers. But let's break this down further. First, why are so many patients going to the wrong service? For many, it's simply the easiest or only option they know. If a GP appointment isn't available, the next step is often urgent care or A&E. Many people don't realise pharmacies can provide clinical advice, or that certain conditions can be accessed through digital triage. Second, the referral loop issue. A patient calls NHS 111 only to be told to go to their GP. Their GP phone lines are full, so they're redirected back to 111. The endless cycle delays treatment, frustrates patients, and increases demand on an already overburdened system. This is not a system designed for efficiency. It is not designed around the patient experience. Instead of supporting people in making the right decision, the system forces them to figure it out on their own. We need a system that removes these barriers, one that doesn't just present multiple options, but proactively guides patients to the right care at the right time. That's where intelligent navigation comes in. Navigating the NHS should be straightforward, but in reality, patients face a maze of choices. Many don't understand the difference between services, and each interaction feels like starting over again. Patients get looped, causing delays and frustration. They lack clear direction, leading to unnecessary A&E visits because it feels like the safest option. Each interaction requires patients to repeat their symptoms, adding friction, frustration, and inefficiencies. This isn't just inconvenient, it has real consequences. The lack of integrated real-time guidance forces patients to make complex healthcare decisions without the right tools or information. They need more than just a list of services. They need clear, actionable guidance that helps them to the right place first time. This is why we need a solution that removes complexity, reduces patient stress, and ensures the NHS works smarter, not harder. Traditional information architecture relies on fixed hierarchies and structured pathways. In many industries, this approach works well, but in healthcare, static systems create unnecessary friction. Static IA assumes a one-size-fits-all pathways, failing to account for the complexity and urgency of individual cases. Patients are expected to navigate services on their own, often without the necessary knowledge or support to make informed choices. Information is not personalised, meaning that a young adult with minor symptoms receives the same options as an elderly patient with complex medical history. There is no real-time adaptation. Service availability and patient-specific risk factors are not factored into navigation. Healthcare is not a simple look-up system. It requires adaptive, AI-driven guidance that considers patient history, symptom severity, and real-time service availability. A true effective system would guide patients dynamically based on their personal context, adapt recommendations in real time, considering available capacity and clinical urgency, reduce decision-making on patients, ensuring they reach the right care first time. Intelligent navigation changes this by embedding AI-powered dynamic triage directly within some of our national NHS platforms like the NHS app, ensuring a seamless guided journey for every patient. Current navigation systems present multiple disjointed entry points. What we're trying to do is create a single AI-powered system that creates a single digital entry point within the NHS app, ensuring a consistent experience for all patients, no matter where they start. The system will guide them automatically. Intelligent segmentation, so patients are routed based on medical history, symptom severity, and risk factors. Real-time service availability integration. The system considers local capacity to direct patients where care is most accessible. A direct booking and follow-ups. Instead of vague recommendations, intelligent navigation schedules appointments directly. And by aligning demand with capacity, we can create a system that works smarter, reducing inefficiencies and stress for both patients and clinicians. The transition from traditional fragmented healthcare access to intelligent navigation represents a real step change in how people access and experience care. Instead of forcing patients to self-navigate disconnected options, intelligent navigation provides proactive guided care that meets their individual needs. Patients no longer have to guess where to go. Instead of searching multiple websites, calling different services, or waiting in long queues, they receive clear communications tailored to their symptoms, medical history, and location. Real-time decision-making ensures faster, safer access to care. Instead of manually assessing their situation, patients benefit from AI-driven triage, which dynamically adjusts based on urgency, availability, and risk. Imagine this: a patient wakes up in the middle of the night with severe stomach pain. They don't know if it's something serious, and they're unsure of the next steps. Instead of searching, they open the NHS app. The system checks their medical history and factors in that they have recently had minor surgery. Based on real-time demand, the app determines the next best course of action, whether that's a virtual GP consultation within the hour, urgent care, or self-management guidance. If needed, the app books the appointment instantly, integrating with local services to ensure a seamless experience. For the patient, the process is simple. For the NHS, it means reduced pressure on urgent care, better resource allocation, and faster access for those who need it most. Using patient history and symptoms to enable better navigation is the hypothesis that underpins the work that we're exploring, ensuring that individuals are directed to the right service from the start, reducing unnecessary referrals and improving patient outcomes. We propose a unified model where patient symptoms and medical history are taken into account from the very beginning, enabling a more accurate triage decision. This is moving from a system where patients must choose between multiple access points with little guidance or interaction to a single coordinated navigation system that directs patients to the right care immediately without unnecessary delays or handoffs. The current NHS navigation system treats all patients as if they have the same needs and challenges. But we know that healthcare is not one size fits all. Patients present with different levels of complexity, and their care needs vary significantly. A more tailored approach is required to reduce those bottlenecks and improve care pathways. But understanding the different levels of complexity that a patient experiences is really key. And we've broadly divided these into sort of the RAG status here on the screen. First one is complex. These patients generally have long-term conditions, multiple health issues, or ongoing care requirements. They need continuity of care, meaning that they require consistent access to the same clinicians and specialist teams. Current systems often fail them by forcing them into generic triage pathways that do not recognise their established care plans. Intelligent navigation ensures they are identified early and routed appropriately, maintaining their access to integrated care teams and avoiding unnecessary delays. Medium complexity. These patients might have some pre-existing conditions that are relevant to their current symptoms, but do not require specialist interventions every time. Navigation must consider medical history and risk factors when directing them to the right care. For example, a patient with high blood pressure experiencing headaches might require a GP assessment rather than being directed to self-care. And non-complex patients, these are otherwise healthy individuals who present with self-limiting conditions that do not require GP or hospital intervention. The current system often directs them to GPs unnecessarily, taking up valuable appointment slots. With intelligent navigation, these patients can be safely guided towards self-care, pharmacy consultations, or digital advice, reducing strain on an already overstretched service. Why does this matter? Undifferentiated pathways lead to bottlenecks. If all patients are funneled through the same triage and referral process, urgent and complex cases are delayed, while simple cases consume unnecessary resources. So rather than forcing all patients through the same triage model, intelligent navigation applies dynamic, personalised decision making. To create an effective, scalable and patient-centred system, we've got to balance national strategy with local flexibility. Now, our approach is designed to ensure that every region has the ability to tailor navigation models to their unique needs while maintaining a consistent experience across the NHS. Healthcare demand varies significantly from one region to another. Local NHS systems need the ability to shape navigation models that work for their populations. But while local customization is important, patients should experience a unified journey regardless of where they are. The NHS app serves as the central digital entry point, giving patients a consistent experience. AI-driven navigation integrates across national digital channels, ensuring every patient has access to the same high-quality triage and guidance. A one-size-fits-all will not work. Regions must be able to configure those navigation models to their specific healthcare landscape. However, we must find a balance and ensure consistency, safety, and quality for all patients. We're currently scoping some regional pilots across multiple NHS locations, and these pilots are designed to evaluate which capabilities provide the most value. So this is about testing different approaches to digital triage, symptom-based navigation and integration at a local level, assessing the effectiveness of real-time service availability in reducing unnecessary A&E and GP visits. We will be assessing real-world impact before scaling nationally. Pilots provide us with an opportunity to collect data-driven insights on patient behaviour, system performance and clinician feedback. We will be tailoring the system to different NHS regions, so no two NHS regions are the same. Piloting allows us to test the system across a variety of different settings, including urban and rural areas, high demand hospitals and underutilised community services. As part of our initiative, we will be piloting 2 models in London to test how AI-driven triage and streamlined digital navigation can improve patient outcomes and optimise resources. The first pilot objective is to evaluate whether AI-powered triage enhances assessment accuracy, increases clinical productivity, and ensures more appropriate service users for non-urgent patients. The second pilot, that's our second pilot, sorry. Our first pilot objective is to test whether reducing the complexity of triage questions in the NHS app leads to better patient guidance, reduced demand on urgent care, and improved access to GP services. Sorry, I'm riddling these. I'm conscious that you want to have a break, and I've just got a couple of slides to finish. So as we develop and implement our approach, we are committed to a set of core design principles that ensure this approach is not only effective, but also sustainable, patient-friendly and aligned with NHS priorities. We will lean on the knowledge and existing capabilities of local systems, prioritising the efficient reuse of capabilities before we build or buy anything new. A key challenge for us is identifying what we should be owning and supporting and building nationally versus locally. That's a real challenge for us as we embark on this project. However, we will remain focused on validating our hypothesis as I've laid out and being evidence-led as much as possible. The success will be measured by real-world impact on patients, clinicians and the NHS system as a whole. Our approach is designed to drive measurable improvements in healthcare access, efficiency and patient outcomes. We are working across a very complicated and fragmented system. These are just a number of the organisations, suppliers and providers that are involved in scoping some of the work that we'll be doing. And we are working with NHS England, integrated care boards, digital partners, frontline clinicians, patients, everyone. There's a huge amount of stakeholder wrangling that's involved in this project. As we look ahead, it's clear that intelligent navigation isn't just about an improvement to technology. It's a transformation in how people experience healthcare. Healthcare navigation has long been a challenge, with patients left to figure out their own path through a complex and overwhelming system. By applying the principles of adaptive information architecture, AI-driven triage, and patient-centered design, we have an opportunity to create a system that guides, supports, and empowers people rather than leaving them lost in uncertainty. By working together across policy, technology, clinical practice, and user-centered design, we can fundamentally change the patient journey and make healthcare access seamless, intuitive, and fair for all. Thank you for letting me come today.
Thank you, Imogen. We'll take just one question from Slido before moving to the break. It's been a lot of content, but definitely time for some refreshments and a break. After the question, we'll come back at past and get into Mike. There's a lot of good questions for Imogen, but top of the list is from Dan. Dan says, I'm sold, Imogen. How do we get NHS leadership to invest in something so utterly sensible as dynamic IA? To borrow from Anya, how do you make it their idea?
Ooh, that's such an interesting one. I love that question, and I think it's something that I think about every day. And now we've had to go on a bit of a journey with this as a team. We were only created this time last year, and we've gone from kind of nothing to like really driving a sort of key strategy in partnership with the system. Now that is the absolute key point that I want to sort of bring up here, that we couldn't have done this or driven the strategy behind this without key sponsorship and doing this in partnership with kind of local systems. Now, I don't know what it is where you work, but where we work in NHS England, we have this concept of like the centre and sort of national. Now, NHS app is seen as sort of a national product, but actually the real innovation and the real work is done at a kind of local level or local systems. Now, local means lots of different things. So we're split in so many different ways in the NHS. But the trick is bringing together kind of national digital capability, skills, resources, insights, expertise with local systems. Those are where the problems are. That's where we need to really focus our attention. And so I think the success has been on finding where those partnerships are, and at the same time, doing a really good job of kind of selling a vision and bringing people on board. I've spent the last year trying to do that and drumming up interest and having sort of senior sponsors. So finding where those advocates are, finding where there's opportunity to partner and go to where the real problems are.
Excellent, thanks, Imogen. There are some really good questions in Slido. If people want to reach out to you, they can contact you through LinkedIn?
Yeah, absolutely. Yeah, please do.
Awesome. Cool. A big hand for Imogen, and let's break.